Good evening, everyone. This is Watana. I'm working for the Payment Certification Agency. Today is a great honor for me to share the experience of the Health Credit Fund implementation in Cambodia. In my content, firstly, I will talk about the Cambodian health system review. And next, I will talk about health insurance coverage schemes and what is the health credit fund and how health credit fund implemented in Cambodia. And lastly, I will talk about health credit fund claim reimbursement process. Okay, firstly, it is about Cambodia health system review. I will talk about the structure of health system. We have a central level, provincial levels, and operational district level, which very low level between the three level, and the operational district level managed of the district referral hospital and health centers, and while the provincial health department managed on provincial hospital, and it also contained the regional training centers, which is we have for health service right now for 4 training centers. While at the central levels, we have Ministry of Health, University of Health Science, a national program, national hospital, and national institute. Next, I will talk about the healthcare delivery system. As I mentioned earlier that we have different levels. So the very top level is a national hospital, which provide a lot of type of services. And but while at the health center is contain several health services. For example, when patient sick, firstly they have to visit health center. If they have a mild symptom, they can go to health centers. If the health center cannot treat a patient, the patient will be transferred to the referral hospitals. While the service at referral hospital still limited, they cannot treat the patient will be transferred to the national hospitals. And this is the end of the system review. And next, I will talk about health insurance coverage schemes. In our Cambodia, we have 3 different types. The first one is health credit fund for health insurance scheme for the poor and for informal worker and for children of informal worker. And this health credit fund currently is implemented by an agency called Payment Certification Agency, which is my workplace. And next one is about National Social Security Fund. And the health insurance scheme cover worker and employees, and also civil servants, and other private health insurances. However, in this section, I will only talk about health credit fund only. So which will be cover only the data of the poor, of the informal worker, and their children. Next is I will talk about what is health credit fund. Health credit fund support access to free health services at the points of use to the eligible population across the whole of Cambodia. The medical services and non-medical benefit to provided to the target eligible populations defined in the MOH national guideline for the benefit package and provide the payment mechanism of the health credit fund. Those documents may be updated from time to time and eventually replaced by a successor manual that will automatically be reflected in the services, beneficiaries, and systems described in that manual. Next, as described in the health credit fund operational manual, The vision of the High Liquidity Fund is to enable active social and economic participation of poor and vulnerable residents of Cambodian society through the universal access to an essential package of quality health intervention, thereby providing financial protection against the consequences of ill health. For the fourth point, I will talk about how this High Liquidity Fund implemented. Currently, as of December 2021, by the source of PMRS system, health facility coverage for this High Liquidity Fund, total we have 1,331. Cover the national hospital, and totally is 6, and 25 of provincial referral hospitals, 92 district referral hospital, 69 former district hospital, and for the most of the health center is 1,139. So totally we have covered health facility for health equity fund is more than 1,000 health facilities. Next, I will talk about the health beneficiary coverage. The data also as in 2021. We have covered the target population of poor household. We will divided by type of card, like pre-identification, produced by Ministry of Planning. Currently total number of this card, we have almost 3 million. Like the number display is almost 3 million, while post-identification, it is produced by health promoter at the referral hospital, around 200,000 cards. And also a same card, but it is produced at the health centers. We have around 12,000 cards. So total for the poor household population, around 3 million cards. Next is about the beneficiary coverage of informal worker. We divided into 2 types, purple card and yellow card. The purple card we have around 56,000, and while the yellow card we have 38,000. So totally of both population we have 3,105,000 cards. Okay, next, this is the data of health credit fund certification claims from year 2019 to 2021. We have 2 types of benefit package. I will detail it in later slides. So this first one in 2019 for medical cost, the health facility requested for more than 75 billion reals in Khmer currencies. PCI has deducted the cost around 1,139 million reals. So for medical costs, the total claims only 75 billion reals. While the non-medical costs, the health facility has requested for more than 7 billion reals, and it was deducted by 16 million reals. So the total claim reimbursement only for medical costs is like more than 7 billion reals. So total of both medical and non-medical in 2019 is total medical and non-medical that was reimbursed by the high liquidity fund to the health facility was 83 billion, more than 83 billion reals. I'm sorry, it's a bit hard for me to pronounce because it's a lot of numbers. So I hope you can understand by looking at the numbers. So as in 2020, it seems that the health utilization has increased. So the request from health facility has increased as well. So it became 83 billion reals, while the reimbursement was more than 83 million real, and total of that reimbursement was more than 91 billion reals. However, in the 2021, because of COVID pandemic, so the number of claims reimbursement as well as health utilization has decreased. So the request from the health facility became 61 billion real, more than 61 billion real, and the total reimbursement of that year was more than 67 billion reals. So in total of the 3 years of health certification claims cost more than 242 billion reals. It approximately convert into USD approximately 60 million US dollars. So here I want to demonstrate about the health credit fund utilization cases between the 3 years as well. In year 2019, the total cases of poor people, it was more than 2 million cases, while it increased to more than 3 million cases in 2022. Compared as the percentage, it became 14%. However, as I mentioned earlier, because of COVID pandemic, the number has decreased. The cases became just around 3 million cases in 2021. So the rate decreased into 8%, while the number of informal workers in 2019, it was 66,000 cases, and it increased in 2020 to 69 cases, 69,000 cases, and it continued to decrease again in 2021 to just 73,000 cases. So if we compare the rate, it's still very similar to the poor people. The rate that in 2020, it increased into 19%, and it's decreased back in 2021 to 8%. Okay, all the health credit fund implementation, all facilities like payment certification agency or health facility need to follow rule and regulation based on the standard benefit package. This is interministerial progress number 497. It is a standard benefit package that's signed by different ministry. We have this one is Ministry of Economic and Finance. And in the middle, signed by the Ministry of Labor and Vocational Training. And at the end, signed by the Ministry of Health. So next, I will talk about the card of identified poor households. Here, this card is determined of poor household, poor members, and it identify the level of poverty as well. We have two levels, level 1 and level 2. Level 1 we call is for poor, but level 2 is the very poor people, for very poor people. And these poor people are supported under HEF project. It is called Health Equity and Quality Improvement Project. It conducted from 2016 to 2022. Actually, it extend for 1 year. Extend from 2021 to 2022. So this project will be ended in June 2022. So as a report of Ministry of Health in 2022, the subsidized budget of the rural government of Cambodia became 70%, while 30% is from the international donors. So you can see the card, we have two types of card as well. In the left side, it is called a pre-identification card, while in the right-hand side, it is called a priority access card. This card, I will elaborate more in the next slide. For next, this about the scheme for informal workers. For this scheme, it is funded 100% by the government of Cambodia. And for the purple card, it is for identify a local authority or government targeted group. Example, a chief of village or their assistant. While the yellow card, it is for identify part-time workers, or the definition of that is a worker who work no more than 8 hours per week. Okay, the very last card, this one is just implemented. This health insurance scheme cover for children of informal workers. As it is for the informal worker, it is for individually use. So that's why Cambodian Nutrition Project implemented from 2019 to 2022 to 2024 cover for the children. So the project actually activated in 2019, but just activated for HEF utilization or implementation in June 2021. So this card actually identify only the children of informal worker ages under 2 years old. And it is produced at the health center and specify only the 7 targeted provinces. Next, I will talk about the enrollment of those membership. Like first one, you can see the card on the right-hand side. It is for identify the poor people or poor households. We can call this card as a pre-identification card or ID poor card. It conducted by the Ministry of Planning, and usually it conducted at the village or community. Next card is a priority access card, or we call it post-identification card. It is for identify the unenrolled poor when they miss the chance to enroll at the Ministry of Planning. So this card conducted at the hospital only when they get sick, and it's conducted by health equity fund promoters. I will tell you more about this agency in letters. So next card is the the equity card for informal workers. It is issued by the National Social Security Fund, and it's available in most hospital or community based or the office in the field. And for the purple card, it's identified the chief of village or other eligible group. So those people will have to go to the National Social Security Fund Agency to get the card. While for the yellow card, the factory owner or employers need to register for the employees. So here's again the very last card, the new one for the children of informal workers. It will be produced only at the health centers and the target province as well. Okay, in the implementation of the Health Equity Fund, we have the Health Equity Fund benefit package, which was defined in the rule and regulation that I have shown previously. For beneficiaries, it cover medical fee for all type of poor people who hold the card of pre-identification card or priority access card. So when they came to visit hospitals, they will get the medical fee for free. And also if they stay at the hospital overnight, they will get non-medical cost for food allowance, which is around 1.25 US dollar per day for inpatient. And if they have appointment letter or transfer letters, or the woman has the delivery, they have used the delivery service, they will get a transportation allowance, and those transportation will be distributed based on the distances. Like if from the home to the health facility has more than 10 kilometers, they will get around 10 US dollars per trip. Or if it is less than 10 kilometers, they will get only around 5 US dollars. In the case that the patient die in the hospital or health centers, the funeral support for the died patient will cost around 15 US dollars for like the distribution for the funeral of the dead patients. So as I mentioned earlier, those benefit package provided only for the poor households who has both cards on the right hand side. Next, I will talk about the benefit for beneficiary who has card, purple card, yellow card, or the card for children of informal workers. We call it certification for child under 2 years old under Cambodia Nutrition Project. So they only get the medical fee when they get sick and they visit the hospital or health centers. Next, I will talk about the key player in this HEF implementations. Firstly, we have Ministry of Economic and Finance that we are coordinated the development of a strategy for development of Cambodian social protection system, which includes social health insurance that encompass the health equity fund. Next is the very special and important key stakeholders, the Ministry of Health, containing a lot of Department of Planning and Health Informations, Department of Budget and Finance, like health facility, healthcare providers. I will elaborate in the next slide for this Ministry of Health. And payment certification agencies certify for a claim review, and health equity fund promoters. And last, the very important key player is health financing steering committees. We have two levels at district level and provincial levels. It is this committee is chaired by deputy governor responsible for health sector to review all health equity fund monitoring finding, utilization report, review of any issue encounter, and provide proper solution of its discuss challenges. So next I will talk more about the key stakeholder of this HEF implementation. First one is Department of Planning and Health Informations. This department leads technical development on health financings and provide payment level and method benefit package composition in health equity fund. And secondly, it is about Department of Budget and Finance. This department ensure adequate financial management capacity at all contracted health facility. It means that only register health facility with health equity fund can receive the claim reimbursement. Next, this department produce financial management reports on disbursement funds for health equity fund to health facilities, and transfer payments which certified by payment certification agency directly to health facility bank accounts. So this department is play really important role in budget reimbursement for this health equity fund. Next, the healthcare provider who implement this and provide health services to patients. Firstly, all public health care provider have to register into the payment management and registration system, or we call it in short by PMRS, which means that all the public health facility wanted to claim for health equity fund, they have to register first and agree to all terms and conditions of the health equity fund under the HEF project. So here's some role that at a referral hospital has to do. First, I will talk about the referral hospital that they have to provide hospitalized health equity fund beneficiary with transportation as well as food allowances. Or in the case they are the patient dead, they have get the funeral support. And referral hospital have to verify monthly health equity fund utilization in order to submit those invoice to PCA for verification. So this verification at the health facility as well as submit for PCA to verify. Next, the hospital also has to update the record of full household who are eligible for these health equity fund benefits. After that, I will talk about the implementation at health centers. At health center, they have to verify identification of health equity fund beneficiaries, and they have to properly record those utilization cases of that beneficiaries, and also provide non-medical benefit to eligible beneficiaries. And again, similar to the hospital, they have to submit monthly invoice of that utilization cases. So here I will talk about health equity fund promoters. that this is the agency contracted with the non-government organizations. Currently, we have two agencies called, the first one, ACP, it is Association of Community Health Protections. One organization, and another organization is a community health organization. These two organizations currently their work is to ensure the beneficiary are treated with due courtesy, care, and respect in hospitals. Because their base station is in hospital only. And they have to provide information and guide the beneficiary to get appropriate services. And well, the very important role, they have to conduct a post-identification interview in the hospitals and work with community to increase the uptake of health credit fund benefits. Okay, here I will talk about my organizations, the PCA, Payment Certification Agencies. It was established by subdegrees in 8 September 2017 by the Prime Ministers, and it was established as the public administrative entities fall technically under Ministry of Health and financially support under Ministry of Economic and Finance. Currently, our office located in the Ministry of Health, the same address. And here, role of the PCA, we had to ensure that we provide a certified invoices submitted by all the public register health facility to the MOH before the reimbursement are made to facility by bank-to-bank transfers. So as you can see in the picture on the right-hand side, here is the process of PCA for claim reimbursement and claim certifications. Here, previously it is known as Health Credit Fund Implementers, but as PCA established, all the work of this implementer was replaced by the PCA. And under PCA, we have several officers to support the work of monitoring and certification invoices. Like we have Health Financing Technical Officer, the supervisor of the Health Equity Fund monitoring officers. For the monitoring officers, they have to manually verify the Health Equity Fund beneficiary by interview the patient at the bedside interview, at the household, as well as they have to conduct a document review at the hospital or health facility. And one more task is that they have to register complaint into the system. So this officer also have to join the Health Financing Steering Committee as well, to provide the result of their monitoring to the chair or the meetings, so that both provincial or district committee will take action all the challenges, all the finding as well, so that then the meeting of the steering committee will report the result to the Department of Planning and Health Information System. While Health Financing Technical Officer will report for the finding or a result to submit all the certified claim or invoice to the PCA, and PCA will be submit to the Department of Budget and Finance to reimburse the claim to the health facility. So next, here I like to mention a little about the vision of PCA to make sure that the work of PCA is efficiently monitor, verify, and certify claims for social health protections. And mission, we have to make sure that the monitor or verify of those claims from the health facility will be used by the ICT system for health equity fund. And after 2024, the PCA also want to expand itself to provide more like expertise services on the health service. Like for example, right now, this institution trying to monitor and verify on the National Social Security Fund schemes, but the rule and regulation hasn't released yet. So right now we're just working on the health equity fund. So here we come to the fifth point, also the last point of today's sessions. It is about health equity fund claim reimbursement process. For this review of invoice or claim cases at the health facility, the health facility has 4 days to review those data before they can submit to the PCA, while the PCA has 5 working days for review those invoices. And then the Department of Budget and Finance also has 5 days for the review. And for this process, we use the system called Payment Management and Registration System. So by using the system, we use only 14 days for this claim reimbursement process. So I like to highlight the summary role of the claim reimbursement process stakeholders. First one, the very important facility is health service providers. We have the accountant at the health facility has to prepare the invoice and do the data entry, and they have to revise before they can submit to the director of the hospitals. And then the hospital director will review the claim submitted by the accountant, and if they have problem, they will feedback to the accountant. And if it is okay, the claim invoices will be sent to the PCA. So the PCA work is to follow up submission from health facility and has to review and certify the invoice, and also like the follow up the submission certification from the technical officer, because this technical officer had to have the main role to verify and certify the invoice. So, and then if everything is okay, PCA will prepare invoice and get it signed and then submit to the Department of Budget and Finance. Sorry. So then the Department of Budget and Finance, after receives the certified claims invoices from the PCA, they will have to review, and if they found the problem, they can feedback to the PCA. And if it is okay, they will prepare a legal document and then input the date of transfer to the health facility and prepare the budget ready to transfer at the bank. And the transfer of this reimbursement process is made by bank to bank. So I think this very last slide and very important in this claim reimbursement process. It is the system that I mentioned earlier. The PMRS is a web-based application used by the registered public health facility in health equity fund. So it is used to manage patient and financial data. It is used specifically to manage individual eligible for health benefits and have utilization and manage on billing and provider payments, and also very important role of very important system for PCA to certify and verify the invoice. So here is the last slide of my presentation, and thank you so much for your attention for my speech. Thank you so much, and if you have questions, feel free to ask.
Yes, thank you for that presentation, Ms. Sovanana. Thank you for sharing your work with us. I would like to read the first question in our chat box. It's from Dr. Bunchai, Chair of the Asia eHealth Information Network. What does pre-ID mean? And who issues the card and maintains the beneficiary registries of each card type?
Thank you so much, Dr. Bunchai, for your questions. Pre-identification mean to identify the poor households, and it is produced by the Ministry of Planning when they have the round to conduct it. And the Ministry of Planning has the staff to go to the community and register those poor people. And they have tool and questionnaire to interview the people and to make sure that those people are really poor households. And yeah, I think I answer who issued the card. It is the Ministry of Planning. And the card has the expiration date on that. So as currently the card can last for 4 years, and after that, the Ministry of Planning will have to renew the card for like next round. After 4 years, they will issue new card for that poor households, and it's identify all the poor members, just one card.
For our next question, it's from Dr. Hannah Kaiser. So the question is, coverage of informal workers under the yellow card was at 43,239 in December 2020. Do you know why the number of registered individuals decreased to 38,000 in 2021? Do people have to renew their membership regularly, or what makes people drop out?
All right, thank you for your like many questions. Actually, the problem is that the number of beneficiary decrease because sometimes after the expiration of card, like the purple beneficiary hasn't gone to the NSS agency for renewal. So it actually for the as of the COVID pandemic. So sometimes people don't go out or they don't want to meet different people. So it's also the problem in this decretion. And also like the owner, the employer, or the worker, the factory worker didn't register their part-time workers, because if they have to register that they take time, or they have to take like gather all their employee to that agency. So actually, this is implemented by the National Social Security Fund. So maybe they haven't promote on that, so people don't really interested in these schemes. Like if they actually also the same as the pre-identification card or priority access card, they have the expiration date on that. So if they want to when the card is expired and they want to get a new card, they have to go to get a renewal card. And it regularly based on the type of cards. Like for the purple card, it lasts for 3 years, while the yellow one only lasts for 1 year. So they have to register again regularly.
Thank you, Ms. Savatana. Dr. Hannah has a follow-up question.
Thank you. I was just wondering, you also introduced the scheme that from June or July 2021 for the children of informal workers. And I was wondering if the two schemes, so for instance, the yellow card is connected to the scheme for the children of informal workers, or if these are two separate schemes.
Yeah, thank you for your question. These two scheme is actually a different scheme and it's supported by different funds. But for the card, for the referral document, it's really related because unless the father or the mother who hold the purple cards or the yellow card, they have the children under 2 years old, and then they want to like for this card they only use the health service for themselves. It is used individually. So if they want to get free health service access for their children, they have to take their children to the health center, which provide those service for their children. So it is also the new scheme that was supported by a new project called Cambodian Nutrition Project. It actually has the time duration from 2019 to 2024. But it just activated in this June 2021 for health service access at a health center and at the 7 target provinces.
Thank you very much. That was very clear. And thanks for a great presentation.
Yeah, thank you.
Thanks for that, Dr. Hannah and Ms. Savatana. We also have a set of questions here from Sir Sarav from GIZ Nepal. So maybe we can answer the first two questions, Ms. Savatana. So what methods are PCAs using to review and certify claims? And do you have automated checking as well?
I think I also mentioned in my slide previously. We have several operational procedures and standard document for implementation in our organization. So currently we previously in the HEF OM, it has 3 different type of methods. Like first one, the monitoring HEF monitoring officer has to conduct document review at the hospital, and secondly, they have to interview the patient at the hospital. And the last method, they have to visit the patient at their house and do the interview. So it's called household interview in order to certify the claims.
Okay, thank you, Ms. Savatana. There's another set of questions here. So is each and every claim reviewed, or do you sample? And how many people are available at the PCA to review the incoming claims?
Currently, we have we have 2 different types of officers. The first, high liquidity fund monitoring officer working under the high financing technical officers. So currently we have more than 60 officers, including both types.
How many claims come in for review on average every month?
Actually, for this one, for cases or for the invoices?
The invoices, yeah.
Invoice for the invoices. I think I forgot the numbers, but maybe I will mention that in the next webinar for this data if you would like to see more about that. Next time I will talk about the system. So I will bring up those data.
Thank you for that, Ms. Savatana. I think our next webinar will be around April. For the next question we have from Dr. Joshi. So is there a possibility of fraud claims? And if yes, how do you identify those?
Yes, the fraud. Yeah, we have deducted the claim reimbursement from the health facility. So actually we found that it is a fraud, so we deducted. And currently PCA has implemented the fraud detection systems. It will automatically detect some triggers that we think it is a fraud. And previously, we identified that by the health monitoring officers.
Yes, thank you, Ms. Savatana. I think that is the last question for tonight, and there are lots of congratulatory messages in our chat box from Dr. Logan, from Dr. Feaktra, and from Dr. Zarni Lin Kao, and also from Sir Sarav.
Thank you so much, everyone.
All right, thank you so much for that presentation and for the wonderful Q&A, Ms. Savatana, and to all our participants for actively participating in this session. And before we end, maybe we can hear a few words from Dr. Bunchay.
Thank you very much. It's very informative and really benefit Ms. Savatana, and I really happy that we can learn a lot from the growing insurance system in Cambodia, and we hope that we can learn more and we can share the knowledge between our AeHIN member country. Thank you very much, and we are looking forward to know more on what you have done in Cambodia and whatever you would like AeHIN community to be to share the knowledge. Please let us know. Thank you very much. And thank you for every participant. And don't forget to visit the next webinar on open EMIS and the other issue.